presence of nodules. So lastly is we now proceed to the neurological assessment. So now we must assess the patient's mental status. So first, we must evaluate the patient's orientation to person, place, and time. So, pwede ako kapangutan na, sir, kung siin ka makara, sir?
Iya ako sa magbukod pa ako.
Sir, pwede ako kapangutan na, sir, kung anong oras yung makara?
9:30.
9:30. So, sino yung mga kaibahan, sir, sa inyong bagay?
Si mama, si mami, si nanay, at si ate.
Okay, so it seems that the client is alert and can answer the questions accurately. So now let's proceed to evaluate the level of consciousness of the patient. So it seems what I observe is the patient is alert and awake, and it maintains eye contact to the um, interviewer, which is me. Next is to assess the memory of the patient to if the patient can recall the recent events and the past events. So, sir, pwede ako kapamunta na, sir, kung nag-alit ka na, sir?
Nagbuo ako exam
Nagbuo ka exam sa siin, sir?
sa ACC.
Sa ACC. Siin to ACC nga, sir?
Sa Palibot.
Okay. So, pwede ako kapamunta na, sir, kung ano yung naalala niyo, sir, sa past events niyo, sir, no? Kung January, sir, ano po yung ginawa niyo po doon?
Nag-ate-ate.
Nag-ate-ate ka, sir. Sino ka, sir, nag-ate-ate?
Sa Palibot. Makulan.
Mga anong adlaw ako, sir, kung nag-amto?
January 16.
January 16. So it seems that the result is normal, which is the patient can answer and recall the recent and past events. Next is to assess the abstract reasoning by asking the patient to explain a sub-problem. So, pwede ako kapangutan na, sir, kung ano yung pagkakaintindi, sir, sa the early bird catches the worm, sir. Ano yung pagkaintindi mo, Carl, sir?
The early bird catches the worm. Kung the early bird ay ikaw, for example, at the worm ay the goal, mas maunahon mo maabot ang goal compared sa iba kung early ka.
May point ka man, Carl, sir. Then, after that, it seems the result is the patient or the client is able to interpret the phrase provided. So now let us proceed to evaluate the patient's ability to understand spoken and written word. So, just like what I said earlier, na naintindihan naman ni sir and na-able to interpret naman niya yung proverb. So now let us proceed to test the cranial nerve function of the patient. So first we must check the cranial nerve 1, which is the olfactory, by asking the patient to close the eyes and occlude one nostril and then identify the smell of the given substance. So pwede kang close your eyes, sir. Close your eyes, sir. I-determine mo tapos, sir, kung ano siyang klaseng substance or anong object po siya, sir. Is that okay with you, sir?
Yes.
Ano pong naamoy niyo, sir?
Alcohol.
Alcohol. Okay? Ako, sir? Perfume. Correct. It seems the patient can smell the substance accurately and no signs of discharges to the patient's nose. So now let us proceed to check the visual acuity and popularity constriction of the patient, which is the cranial nerve to optic, by identifying the visual acuity of the patient. So we must determine if nagko-constrict po ba siya and nagda-dilate using the pen line. Okay, nagko-constrict naman. Now, next is to determine the test visual acuity of the patient. So, meron po tayong ipapabasa kay Sir. Since I don't have a Snellen chart, I will use some words to make the patients say it to determine yung visual acuity ng patient is normal. So, here it is. The words that the patient should read. It must be far away from the patient. So, pwede nyo po ba, sir, itabunan nyo po, sir, okay, left eye nyo. Sign nyo po, sir.
Today is Tuesday.
Okay. So, yan din, sir.
Today is Tuesday.
Okay. How about din po, sir, sa kabila? Sa kabila? Kabila rin. Sir?
Today is Tuesday.
Sa dulo, sir?
Today is Tuesday.
Okay. It seems the patient's visual acuity is normal, no involuntary, as well as no involuntary movement like nystagmus. And it seems that the patient's eye can relax to light. Next is to proceed to move the patient's eye through the 6 cardinal positions of gaze, which is the cranial nerve, oculomotor. So, sir, yung gagawin lang po natin, sir, is itong pen light po natin, susundan nyo lang po, sir, ha? Susundan lang po natin to, sir. Okay, it seems that the patient can react to the accommodation, which is the movement of the pen light in 6 cardinal positions. So now let us proceed to ask the patient to smile or frown to determine if there's any kind of droopiness, that signs of stroke. Pwede ko bang i-ask, sir, kung mag-smile ka, sir? Simangon, sir? Galit, sir? Can you ba, sir, i-pop yung cheek niyo? Okay. Then, it seems, sir, na can move the facial movement normally and no signs of droopiness. Next is to check the hearing acuity of the patient. So there are 2 types to determine the hearing acuity of the patient, which is through whisper and to normal tone. So first we must test the whisper tone of the patient. So now I will proceed to test the hearing test of the patient through whisper tone. So itatabunan po lang natin siya yung right ear niya, and dito po sa left ear niya, determine po natin kung marinig niya po yung whisper tone ko. Okay? dapat yung the distance is between 2 to 1 or 2 meters. So, pwede nyo pa ba, sir, itabol yung teka nyo po? Okay. Repeat my words, sir, kung narinig nyo po, sir.
Flower.
Flower. Okay, dito rin po, sir, sa kabila.
Kick. Stone.
Okay. It seems that the patient's hearing tone through whisper is normal. So now let us proceed to determine the hearing acuity of the patient through normal tone. So repeat my word lang, sir. Repeat my word lang, sir. Aklan State University.
Aklan State University.
Okay. And how about this one? Aklan Catholic College.
Aklan Catholic College.
Okay. So it seems that the patient can hear my words accurately and no abnormal findings. So now let us proceed to test the gag reflex by touching the posterior pharynx with the tongue depressor. So now I will be using tongue depressor to the client. So first, we must assess the client's teeth and as well as his tongue. If there's any signs of cavities and okay, mga sir, mga pa sir. Okay, so it seems I will be using pen light to see in the inside of the patient. Okay, pwede mo po ba, sir, ilabas yung dila niyo po, sir? Pwede niyo po ba siyang i-move, sir, from left to right? Okay.
Get kick.
Nga pa, sir. Say ah. Ah, sir. Another one. Okay. It seems the client's tongue as well as the tonsil of the patient is in the midline. So now let us proceed to test the gag reflex of the patient. Sir? Okay. It seems that it has a gag reflex. So now let us proceed to place the hands on the patient's shoulder while he or she shrugs against resistance. Okay. So we must put our hands on the patient's shoulder and shrug. Sir, pwede mo pang i-shrug, sir, yung okay, may resistance. Then place the head of the patient's left cheek, then to determine if the patient's cheek has a resistance also. Okay, back mo, sir. Okay, thank you, sir. Then yung dila niyo po, sir, pwede mo pang i-resist po, sir, yung ano. Hindi, dito po, dito, sir. Yan. Okay, how about the other one, sir? Okay, it seems the patient has a resistance in the shoulder as well as the tongue that pushes the cheek. Let's proceed to ask the patient to extend the arms forward and then rapidly turn palms up and down. So, arms forward, sir. Both sides, sir. Then, turn palms up and down, sir. Good, sir. It seems there's no abnormal findings occurred naman as I observed.